Good evening, everybody. And today's topic is very different, nothing to do with metaphysics. It is all science and neurology. So let's begin. Integral eye movement therapy, which is popularly known as IEMT. And the tagline, creating change in the blink of an eye. This is exactly what it is. Let me give you a brief of how it began. Okay, so the two people that you see on the screen up on the left, that is Steve and Connery Andreas. These two are absolutely wonderful people, and their contribution to the field of NLP is absolutely unmatched. Steve has written a lot of books on NLP, and Connery is one of the first few people in the field of NLP who has made an attempt to combine, I would say, NLP and spirituality. And her work cannot be missed. So they came up with something which they called as eye movement integration. And this gentleman here at the right bottom, Andy D. Austin, he developed that further, and what we have as a result of that is the integral eye movement therapy today. You know, if you look at the traditional therapy, the way counseling used to be before NLP came around, and for people who are not familiar with NLP is neuro-linguistic programming. To put it absolutely simply, the conversations that we have with the world and what we say to ourselves, which is our thoughts, this is what is making us. So we are writing our scripts based on this neuro-linguistic programming. Now, before the advent of NLP, which came in 1976, therapy used to be very different. It used to be long sessions after sessions. At times, it used to take people 2 to years to recover from a particular problem. Then came NLP, and suddenly those 2 years became short. Couple of months, even couple of sessions, it started to give results to people. Now, few people like Connery, Steve, Andy, what they have done is they have taken some of the concepts of NLP and they have devised what I call as neurotherapy tools now. Now, these tools make everything even simpler. To give you an example from my own life, I've been into this field for 13 years now. In the beginning, when I used to take coaching therapy sessions, typically for a tough case, it used to be 8 sessions, 9 sessions, would go up even till 10 sessions. From the time I have integrated his work and other new works, the sessions are at the max 4, or if it's a severe case, it's like a 5. I don't go beyond that. So this is what IEMT has done to a lot of coaches, trainers, healers. It has integrated the human being's problems and challenges in such a manner that the person is able to live to that full potential. As you see, the behavioral patterns and responses that were set up earlier in life, IEMT tells you that you have an option of going ahead and changing that. And that change need not be tough. For example, if I talk about the absolute basic pattern of IEMT, it is an under 5-minute process. And the kind of changes that come about is amazing. When I do it with friends or fellow trainers who have not been exposed to that modality, they often tell me, what did you do? Did you hypnotize me? Is it magical? I'm sure it won't work. And by tomorrow, I'll be back with those memories or those feelings again. And I, with full confidence, tell them, okay, if that's what you think, tomorrow's going to be here. I am here. You're here. We'll talk about it. So how did it all start and what really happened? People who are familiar with NLP would be definitely familiar with this chart here. For others, I want to tell you that NLP came up with something which says that eyes don't lie. And that is that if your eyes go in a certain direction, then it gives you indications about the other person. So if it is, for example, going up towards your right, that says that you are daydreaming or you're imagining something. If it goes up to the left, you are recalling. So if you were to recall, for example, what did you wear on your wedding day or on your day of convocation? Your eyes, ideally, according to this model, should go up to the left. Now, I must warn you, this is not something which is sacrosanct. It is not generalized that it happens for everything and everywhere. And people who've used it as a generalized model, they have come to realize the limitations of this. Now, Andy, since he did NLP, he knew this model very well. And he's been a nurse in the neurosurgery department, and he knew about how the brain works. So he just combined the two, and he figured out that there is an optic nerve that is going into that part of the brain where memories and feelings are stored. Therefore, there is some connection with the way eyes are moving and memories and feelings. When he started to explore that, he came up with this technique. And an example that he often quotes is that in one of his normal days, he was just passing through a room and he saw there was somebody who had come in for therapy. And the only thing that person had to do for 40 minutes was to look at two bulbs from this point to this point laterally. And in one of his mischief activities, what he did, he tilted that and he made it like that. Now, after coming for months and months and doing that for 40 minutes, when he did like this and his eyes moved from this direction to this direction, that patient didn't turn up the next day. Now that intrigued him. He wanted to figure out what happened. He called that patient and he said that, you know what, I don't need it anymore. Somehow something happened yesterday and I'm fine. And that's where he figured out when the eyes move in certain directions, these three directions that are shown here, there is some kind of change that comes about. And that optic nerve, which I've been telling you, is connected to the limbic brain. What it does is it causes that emotional release, and the charge the negative memories have on us, that kind of just loosens up. So what does it do? What does it alter? First and foremost, it alters emotional imprints. Let me take you back to the basics. As a child, a real young child would not have recognition of experiences with feelings. He would be jumping, he would be excited, he would be crying, and that is when an adult around him would tend to tell him that, oh, you're jumping. So this means you are happy, you're joyous, or you're excited. And if the child comes back being upset, screaming, it is that, oh my God, my child is angry today. Oh, he's sad today. That is when, at that age, the child decides that, oh, if I do like this, this means I am angry. If I react like this means I'm excited. So he starts to bucket his experiences into emotions. And that is how throughout the life it kind of becomes generalized. So one of the things that is happening here is that the child is learning to respond to the environment around him. And that is how we learn to experience emotions. The second way we experience emotions is by modeling it. In simple words, monkey see, monkey do. So children do not do what you tell them to do, they do what you do. Similarly, when we were growing up, we modeled our father's aggression, our mother's poor me attitude, or whatever it may be. And those becomes a part of our plethora of emotions that we experience during our life. Now, what happens with IEMT is that you can alter those emotional imprints. And when I say you can alter that, that means that to the previous experience, the kinesthetic, the feeling response would be different. And that is where another important part of IEMT comes into play. People who are familiar with this integration technique, they would know that this is only one pattern of it. There is something that addresses a lot of life, and that is something which is known as the 5 patterns of chronicity. These 5 patterns of chronicity were observed by Andy when he was looking at clients' patients that were coming in. And he spoke about them saying that these 5 patterns are the foundation for chronic diseases. So if somebody has cancer, somebody has bronchitis, asthma, arthritis, any kind of chronic pains and diseases, there is a high chance that the person is exhibiting either of these 5 behaviors or all of them. We do not have the time to go into all 5, but there is one that I want to mention, and that is what is known as the great what if question. And you may have heard Nikate say that if somebody asks a what if question, he usually says, oh, that's a dangerous zone to be in. What happens when people are in the habit of asking that what if question? What they are doing is that whatever you're presenting, they are giving one counter example of that and trying to hijack the generalization that you're presenting it. According to the normal distribution curve, 66% of 66% of people would follow that. But this gentleman, this person would present one counter example of what you're saying, opposite to that, saying that this is not true. Now, if you engage with a what if question, there is no end to it. Because what he's doing is that he's presenting you only first half of it. He already knows the then part of it. Also, what if integration eye movement therapy doesn't work? Okay, then what you're saying perhaps will not matter. Okay, but what he's giving you is only first part of the sentence. Even more appropriate in the kind of people that we deal with on daily basis are the people that I have seen in the past 3-4 years, having attended to a lot of cases of panic attacks and anxiety, that people who suffer from worries, tension, panic attacks, anxiety, they have a lot of what if attitude. It's like a loop that gets formed. So what if this happens, then this would happen. What if that happens, then this would happen. And this loop would kind of feed itself back, which is directly proportional to the anxiety. So if you see yourself or anybody around you using what if in the sentences, be sure that one, the person knows the then part of it, which is probably not being shared. And secondly, it's directly proportional to the anxiety that the person will be experiencing. The second domain that IEMT alters, which is basically day 2 of the practitioner, is identity imprints. If you look at identity, it's weird how it gets formed. And a part of that stays with you throughout the life. Your name, the order of birth, whether you were the first child, the middle, or the youngest, whichever it may be, your family name, your religion. These are parts of the identity which are absolutely established and you have no control over them. And then there are evolving and developing parts of us which keep happening as a response to the environment. For example, you may be the responsible one. You're the youngest of the family, so a lot of things, a lot of activities or behavioral responses that you give are pardoned. Just because you're the youngest one, no, that's okay. You may be a woman, but you may be wearing the pants in the house, which means you're the man of the house. Now, these roles, when people begin to play for a long period of time, they become part of the identity. And this is one area that IEMT addresses. The second area of identity is that of I am. The traditional therapy would also go into knowing about what happened. So if somebody comes to you with a problem, or if you go to a therapist or a counselor with a problem, it's a lot about, oh, so what happened? Tell me more. Whereas with the new advent of linguistics, so much of information is even not required. We just pay attention to the language that is being used. Let me give you an example. Somebody who says, you know, I feel unhappy. Well, you can see that it's a feeling, it's coming from the emotions. And there is an I that feels unhappy. But an identity would talk about, I am an unhappy person. You get the distinction, right? One, I feel unhappy, so I am who I am, and I have this feeling which is that of unhappiness. The second is, I am an unhappy person. Similarly, when people talk about depression, they may say, I have depression, or I have feelings of depression, which is something that you have, or it's a feeling again, or it is that I am a depressive. Now, we tend to look at it from the angle of identity, and there is quick, long-lasting work that can be done with that. Let me give you another sentence. So the sentence goes like that: I feel afraid I'm losing a part of me each day. Now, a linguistic or an IEMT practitioner would hear it very differently from a lot of you here. There is an I, which is an identity. There is a me. And then there is a feeling of being afraid. So let me say the sentence again. I am afraid that I am losing a part of me every day. Now we tend to break it up and work on it with different patterns using the emotional pattern, which is the kinesthetic one, and the identity one. Let me now take you through all the areas. Of course, not everything is included. Major areas that IEMT addresses. Post-traumatic stress disorder. This is something that I have dealt with a lot of people. If they've been going to a counselor, a lady came to me year before last, and she was going to the counselor for over 2 years. And when I asked her, okay, that's great, but it's a PTSD case. How good are you right now? And she said, oh, well, I'm just about okay, but I don't see much of a difference. And I was amazed that 2 years of therapy, and there is no difference in the person. So in the post-traumatic stress disorder, the first thing that we got to pay attention is that trauma is a series of events that happen for that person. And that person always has two things to say. One, the person will say, I want to be the person that I was before this event happened with me. And the second thing is, I hope at least someone understands me. Cases of PTSD, and we have research on that as well, have been successfully handled with a couple of sessions of IEMT. Let's look at depression and sadness. Now, it's been seen that somehow there is a combination of emotions that exist when it comes to depression and sadness. Somehow, it is only those emotions with a certain time duration and orientation that tend to coexist, which forms the full package of what depression is, of what sadness is. Now, whichever feeling is most familiar with the person, that is where we start with when it comes to depression and sadness. What we are doing here is that our point of beginning for anything is the kind of feelings that people feel. And from there, we figure out a memory associated with that feeling. And once we have that memory, we just run the basic eye movement pattern and a change is seen right there and there. Well, this is not to say this is like, as Andy says, a grand unified therapy, but it tends to work on 90% of the cases. And you would know the first time around if it is not working on something. Anxiety. This is something which is becoming common. To give you an idea, anxiety is typically of the future. So this is coming into a person who feels he has no control over the future, and the what if loop just begins for that person. Now, in such a scenario, it is important to break the what if loop, and hence very important for those 5 patterns of chronicity to be addressed. Along with that, in anxiety, we also got to see the basics of it, which is if you go by the hemispheric study, the right hemisphere of the brain is underactive when it comes to people who are anxious. Therefore, we advise them to engage themselves in activities that involve the right hemisphere, which is something that involves both the hands. So if you remember how our grandmas used to get into knitting, crochet, the modern generation gets into juggling or playing different type of games that get them into a flow zone. That comes very handy and helpful in anxiety, along with IEMT, of course. Panic attacks, fear of any kind. And I have personally seen when it comes to fear that if I combine a session of metaphors, which Andy will be presenting here in a couple of days, and IEMT, the results are phenomenal. There is no need for a person to experience that fear completely. Just a simple sense of it is more than enough for us to begin. And the fear just retracts itself back because, as I said before, the memory that grips that fear loosens after the basic pattern of IEMT. And the moment this grip is loosened, the fear does not really have a base to stay. Guilt, something which is absolutely personal for a person. Remember, whatever you and I may be guilty of, we never go about and tell it to the world. We keep it to ourselves. It's something that I did, and nobody's to know for that. But the point is that guilt is something which remains with us till the end of our lives. And this is something that we see in aged people when you talk about them, how they have a reminiscence of the past days. And they would always, well, mostly end up saying that, you know, there's something that I did which I'm guilty of, or I hope I didn't do this or I didn't do that. Simple stuff. So guilt is something which is handled with the basic pattern. Anger. And anger always is about somebody breaking my rules. So I expected you to behave in a certain way. Well, that's a different story that I may not have told you what my rules are. But I expected you to follow the unsaid rules. Since you did not follow them, the result is punishment, which is I will be angry. Other things that are addressed with IEMT, one is psoriasis. This is a skin disease with patches. And this is one of the diseases which is difficult to cure, and it's a lot of pain for the person who's going through this. There has been research that has been done with patients of psoriasis, and the results they have obtained with 4 sessions of IEMT is absolutely phenomenal. Sexual dysfunctions, again, being extremely helpful. Dental anxiety, we gotta go to the doctor, the dentist at times, and all of us know it can be really anxious for the person. Injection phobia. So different kind of dysfunctions and phobias are also addressed through IEMT. Somebody is feeling unworthy. I am not wanted, I am not important. This is something that can be easily dealt with IEMT. Feeling hopelessness. Flight anxiety. A lot of people have this anxiety when they are traveling, and they could be frequent travelers, but they could still have that anxiety. Is it the right time? Is it the right date? Have I picked up the time correct? Or will I get there on time? What will happen to my luggage? These are common thoughts that come in a person when we are flying. So the IEMT addresses this as well. It also does a lot of good in children, and there is currently research going on in the field of IEMT for that as well. In terms of child abuse, the child may not be open about it. There is a high chance that anybody here would have gone through abuse as a child. But owing to the conditioning and the kind of society that we live in, we do not really talk about these things. But this leaves us with certain feelings inside. And those feelings can result into being a certain kind of an individual. So we address that as well through this technique. Food allergies. And there is a case study on the side that talks about food allergies, that how a little boy in school had allergies to food, and he didn't want to eat the food that was for him, mainly because his friends in school used to make fun of him. Now the food allergies was not that bit of concern, as the feelings that he had around being restricted to certain kind of foods. When those feelings were addressed, he naturally became calm and comfortable with his lifestyle and the foods that he had to eat. Problematic social behavior, being nervous and jittery, and exam anxiety. One thing that I want to point out here that IEMT is something that will not work on anticipatory events of the future. So for example, if an exam is coming up in the month of June and we want to run IEMT on that, no, it won't work. What it works on is take up a memory from the past and then run the pattern to see the difference. And as that memory is taken care of, the feeling comes down and the child is more prepared to handle the exams that are coming in that month. Therefore, the negative feelings that we have, and if we actually look at it, if we were to make a list of these feelings over a week, 10 days, if you were to journal the negative feelings that you have, you would realize that there aren't a lot of them. It may be 8, 10, at the most 15. And these recurrent negative feelings are a good point to start the IEMT process. And as I said, the beginning point is take a feeling, but what we are eventually doing is getting into the painful memories. Negative experiences of the past, we spoke about this. And what happens with this is all of these things on the left tend to decrease. And on the other side, more awareness of the way we behave in the environment, what our triggers are. Choice. If you're playing a certain role for a long period of time, it becomes part of the identity. When you do the IMT work, you realize that you have a choice about it. And the moment choice is added, you can be any way that you want to be. So it just widens up the identity roles that you can play. Gives you power and a lot of resources, makes you happier, and makes you be on the side of life. So what gets kicked out are the things on the left, and what comes in are the things on the right. We have an IEMT association in India, and well, currently I'm the only trainer in the country, but of course we are looking at expanding it, and we want to have a lot of people do this. For me, I think this is an absolute game changer in the field of therapy. And having experienced it myself, I've been doing it now for the last 9 years. I learned this therapy way back. And that time I remember Andy saying that if you practice this therapy for 1 month each and every day, you will see a remarkable difference. And if you just do this therapy, it takes under 1 minute. So I've been practicing it ever since. And then the clients, patients who come in, I've been doing that with them as well. So in future, we are looking to expand it and have a lot of more trainers in the country. Currently, IEMT India is also working with an NGO. This is just for your information, in New Delhi. And that NGO is AAA, which is Shelter for the Homeless. So Soumya and I, we've been going there, conducting sessions, giving them hygiene kits, which actually is becoming very handy at this point in time. And since we are a lot of people here, I will not be able to take you through the basic pattern. I wish I could, but it isn't feasible. Nonetheless, there is a small technique that we do in those 2 days practitioner, and I would want all of you to experience that. I want you to take your attention to that memory that you're thinking. I'm saying that again, please take a mildly unpleasant one. And I want you to pay attention to where the memory begins and where is it ending. So just take your attention towards Where does the memory begin? Okay, I'm going to repeat that. Just pay attention to that memory, seeing it. Look at the start point of the memory and the end point of the memory. Okay. If you had your eyes closed, you can open your eyes. So let's look at this. I'm sure you would have noticed that a memory that you took had a start point and an end point. So there is somewhere the memory is starting, and then at a certain point it ends. So this is the feelings that is attached with the memory and time on this axis. Therefore, in your memory, this is a point where it began, and this is where it ended. Now what I want you to do is that I want you to go to the beginning point. Just go to the absolute beginning of the memory. And I want you to construct what happened before it. So in your memory, at the start point, go before that. And if you do not remember what happened, just make something up. That's okay. In other words, what I'm saying is that give a new beginning to your memory. And I want you to do that a couple of times. So keep adding this new beginning 3-4 times towards the start of the memory. So the initial start that you have of the memory, create or recall what happened before that. What happened before that? What happened before that? Do that for 3-4 times. Okay. Do that a similar thing towards the end of the memory as well. So in your mind where the memory is ending at the moment, I want to create something after that as well. As I said before, if you recall what happened after that, perfect. If you don't, please just make something up. Giving this memory that you have a new end. Do that about 3-4 times. And now I want you to play this memory from the new beginning till the new end. Remember, not the way you started it. Play the memory in your head with this new beginning and new end. Do you notice something weird? How the memory now feels different. This is a small exercise from the practitioner course, which is called the memory editing. Simply, when we add a new beginning and a new end to the memory, it feels different. Somebody is sharing that it has shrunk in size. And yes, merely by its shrinking in size, doesn't it feel different? Pay attention. Does it have the same impact on you as it did before? And yes, I know we picked up a mildly pleasant one for a reason, mildly unpleasant one for a reason. Exactly. This is what happens. As I said, this is just one exercise of the practitioner. This is not IEMT, basic pattern. This is not movement of the eyes. This is just one of the exercises that we do to bring about change in the memory. Exactly, the feelings change. The floor is now open to you for questions. Of course, you can do it on your own as well. Remember, as I said, I will repeat the steps for you once. You take a memory that is mildly unpleasant. Notice where the memory begins for you and where does it end. After you've done that, create a new beginning for the memory and do that a couple of times so that it just gets registered in your mind. And after that, create a new ending for the memory. Do that a couple of times. Now play this new beginning and new ending a couple of times and you will see that there is a difference. There's something else in the chat. Let me look at that first and then I will okay, so someone's sharing that it feels more complete, makes more sense. And there is a pattern or root that the feeling is something else. Okay, deep down in the past. Okay, the feelings have changed. Yeah, so you can go ahead, share your experiences.
Okay,
and any questions
so I'd like you, if anyone wanting to share, please raise your hand. Then we will unmute you and then you can ask your question. So better to ask the question, raise your hand rather than putting it on the chat. Okay, so Manish, go ahead. Manish,
Yeah,
please go ahead.
Yeah, my question is, okay, this I hello.
Yeah, go ahead, Manish, we can hear you.
Yeah, like we are working on mild memories, but there are many a times there are traumatic experiences, and if someone tries to create a make-believe beginning and ending to it, then won't it be the counterproductive? Or for rather more traumatic experiences, the more session is required or IIMT is not suitable. What is the scenario exactly?
Great question, Manish. I'm glad you brought that up. And that is when I kept emphasizing of taking a mildly unpleasant one, something that doesn't really bother you that much, because this exercise is extremely effective. One at that, and secondly, since you do not have me or a coach around, so if things go out of hand, we will not be able to handle it over digital platform. For severe intensity memories, we will not do memory editing. We will run the IEMT pattern and look at other ways of addressing it. So we will not get into this kind of an exercise with severe, high intensity, unpleasant, traumatic memories. I hope that answers your question.
Okay, I think he has gone down, so he has answered his question. Just would you like to run the kind of pattern that we run, or you won't like to do that over here?
Niket, I wouldn't really prefer that for the simple reason that, I mean, it's a digital platform, so at times things can just go haywire. Or if you want to be a volunteer, let's try that.
Yeah, okay, I can be a volunteer.
Yeah.
Okay. So how do you go about that then?
Okay, so switch on your video first of all.
Switch on my video. Okay,
Yeah.
1 second. Yeah, okay. I'm on, but your spotlight. You want me on the spotlight?
I'm okay with this.
Yeah, okay.
So here, Niket, I want you to come up with a memory that's unpleasant for you. So something that troubles you from the past.
Okay, I'll have to really think. Okay, yeah.
No,
Okay.
no, not let's say. Come up with,
No.
with an original one.
Yeah, I've come up with the original one. Okay.
Okay, so people can't see you, so just come on the spotlight video.
Okay, 1 second. You'll have to spotlight me.
Okay.
Yeah.
Right.
I did think I'm going to come on the spotlight. Anyway.
Happens. Yeah. So I want you to think of an unpleasant memory from the past.
Okay, do you want my specs off or on?
No, that's okay. Either way, whatever is comfortable to you.
Okay.
So have you thought of a memory?
Yeah.
Okay. Great. And as you think of the memory, just get a feeling of the intensity of it. How intense is it for you?
Yeah, okay.
Okay. Okay. Do you want to tell me how intense it is on a scale of 1 to 10?
Yeah, I'm feeling a big pressure over here.
You're feeling a big pressure over here. Okay.
Yeah.
Okay. So what I want you to do is I want you to hold on that memory, keep your head still, and with your eyes follow my finger. So can you see my finger?
1 second. I need to wear my specs.
Right.
Yeah, okay.
Yeah. So you just need to follow it through and keep your head still, okay? And hold that memory. So just keep following my finger.
I can't see your finger. You have to raise it up. You have to raise your finger. Yeah, that's better.
Yeah. So follow it left to right. No, I don't see you following it. Keep your head still.
I'm following with my eyes.
Yeah. So left to right. Yeah. With your eyes. Yeah. I don't see you actually, your eyes moving. Yeah. Okay. Yeah. And I'm changing. So up to down. Yeah. Up to down. Yeah. Yeah. This way. The other way, up to down. Yeah. Back to the lateral, left to right. That's it.
Okay, the intensity has dissipated.
Okay. Okay. Thank you so much for volunteering.
Yeah.
So this is what we do. This is how the pattern is run, and this is not the full complete basic pattern. As I said in the talk, it starts with a feeling and then we go to the memory. What I did with him is I only took the memory and I ran the pattern. And it really goes in these three directions. It goes laterally like this, it goes like this, and it goes the other way like that. And as you saw, you heard him, that he said that the intensity came down and it has dissipated. And this is the kind of reaction that we see in people mostly. There are different things that come up. At times it first increases and then decreases. There is a certain number of people on which it does not work, which is what it is, it doesn't work. For a lot of people, it just kind of dissipates or decreases or just goes away. It's different experience for different people. Thank you, Nikit. Thank you for that.
Yeah, pleasure.
So
Does anyone else have a question?
Anything that you want to share?
Okay. Yeah, please go ahead.
Hi, as you just mentioned, there are certain people it might not work. So if you could just give an example or two of the scenarios for people for whom it would not work.
So it isn't about scenarios, it's just on people that it won't work. So it has nothing to do with that in particular cases or scenarios it won't work. It's just that on some people it doesn't seem to work. So there is not a complete understanding one of how it exactly works and changes everything. Similarly, in cases that it doesn't work, it's just with those individuals that IEMT is not working. That's where we have other techniques, other tools to take care of. So there are no scenarios or feelings where it doesn't work. It is more individual based.
Okay, thank you.
Okay, so just anyone can use this on themselves, right?
Of course, anybody can do that. Yeah.
Yeah, and can you do it for others also?
Yes, this is what it is. That is what I said, that this is one technique which you can do it on yourself and others as well. So when we do it, of course, every day on ourselves with various memories, feelings, whatever we may come up with. And of course, you can administer on the other person as well.
Okay. Yeah. So, yeah, Bua, you can go ahead.
Hi, Jess.
Hello, how are you?
I'm good. I just wanted to know, what about the exam anxiety that these children have? I have a granddaughter, 16-year-old. She's now gone to class 12, and because of the lockdown and all, they have these studies online, and and the computers they are having. But she's always, she doesn't concentrate or anything. I find it very tough to handle her at times. But I just leave it. I said, okay, 16-year-old, that's where she's, getting some changes in her body, whatever. So just how can she concentrate on her studies?
With her, what you're saying is that, as you're saying that she's not concentrating, so we got to get to what she's feeling. Exam anxiety is something that you are defining it as. We got to get it.
Not only exam, daily, day-to-day school work or whatever. She always says, Neema, I've done it. That piece. It's the normal thing for teenagers.
Yeah. Yes, of course. Anybody who's brought up teenager kids knows that this, of course, is normal behavior. What we are focusing here on is that if you feel that the child is anxious or there is some kind of reactions that the child has to a particular teacher, a particular subject, or before exams coming in, that is where we know that IEMT can come in handy. We will start with the feeling that she experiences, goes down to the memory that she has of the past where she felt anxious, for example. Run this pattern, what I just did on Nikate, and we will begin to see the difference right there and then. So it's effective for that as well.
Okay, I'll get in touch with you then. Okay, thank you.
Yeah, Smita, can you ask your question?
Yeah. Okay, Jasprit, thank you for the presentation. I just wanted to know that how is it different from ice scrambling technique, which is being used in NLP?
Sorry, I didn't get that. Which technique in NLP?
Ice scrambling.
Eyes scrambling.
Yeah.
Eyes scrambling.
Which one is that? What is the ice scrambling technique?
Ice scrambling, like just moving, using the eye movement from one part to the other part. The chat banker have introduced this technique, and I have done that. And so I just
does it go lateral, or which way does it go?
Anyways, like the diagonal opposite and this side, or from center top to bottom.
Okay, so then I would say from what you're telling me, I haven't heard of this technique. So what you're telling me, it so seems that IEMT is a refined version of that, because we have experimented with all the possibilities in this sphere. from here, here to like this, to like this, to like that, even to the bottom quadrants. And what is seen is that the maximum impact is when we move the eyes left to right, right to left, this way diagonal, and this way diagonal. So there are a lot of experiments which Andy has done with a lot of people. We've been part of those experiments as well. We've done it with clients, seeing that which particular movement in which direction brings about maximum change. And we've come up with these 3 movements which Andy defines, that you go lateral, you go like this, and you go like this. These are the 3 movements that bring about the most change in a person. Thank you.
If I can just add, it actually shifts the emotion, you know. If you try to remember that memory again, you have a difficult time in remembering it again. It vanishes. You understand? So the memory that I was remembering, if I want to remember that memory again, it becomes difficult to recall that because you've eradicated it. It's like a wipeout, you know, it's like you're wiping the hard disk kind of situation. Okay, Hema, you have a question. Can you unmute yourself, please?
I have unmuted myself.
Yeah, Hema.
Yeah. Hi, Jas.
Right.
Hi.
How are you? So,
Very well.
yeah. So, my question is, for how long we have to do these kinds of eye movement exercise, or the graph that you have shown us for a particular memory?
Okay, so there are 2 things that you're asking. Let me answer the second question first, which is that the memory editing, that is not an IEMT pattern. It is just an exercise which you can use to edit the memory. As the memory has a new beginning and a new end, the meaning that your brain has attached to it, it changes, and hence it loses its impact on you. That is one part of the thing. Secondly, when it comes to IEMT, if you actually look at it, this is just as simple as what I did on Nikate, and it is actually under, you know, the complete pattern is under 5-minute pattern. When you get used to it, you just pick up a feeling, get to a memory, or you just pick up a memory and run the pattern. So it really is a game of 40 seconds, 1.5, 2 minutes on daily basis. We tend to do it on a lot of memories that keep popping up. So if somebody, for example, a case of PTSD, that person would have series of traumatic events. Or if somebody has been a victim of child abuse, there are series of events that are related there, and it's a comprehensive package of complicated feelings that are a part of the system. There we tend to run this in various sessions, and you know, in about 4 or 5 times, that means 4 or 5 sessions, that is all right. So an IEMT session can actually be as small as a 10-minute session.
Okay. Okay. Yeah. Okay.
It is not something that works all the times on everybody in every cases, but it's an instrumental tool that helps create changes of emotional responses and identity patterns in people.
Okay.
I would say the beauty of the process is that it's very, very simple. It's very easy to do, and literally anyone can do it for themselves. So it becomes a very powerful tool in your toolbox to create change for yourself, to create shifts in yourself.
Absolutely. Lately, before the lockdown started, I've been dealing with cases of anxiety, panic, suicidal tendencies, extreme depression. And it's amazing that the first time round itself, as the person would come in, I would talk about IEMT, do this particular technique with them, and then ask them to do it every single day, picking up any feeling, going to the memory, or taking up a memory by itself. And then just come back to me in the next session, which typically is in the duration of 7 to 10 days. And there is so much of change that comes about. The person is instantly calm, because you see what's happening here is that the way these feelings is they are gripping us, they kind of just lose their charge completely. As research also says that we have an average of about 60,000 thoughts in a day. And out of the 60,000 thoughts, more than 90% of the thoughts are repetitive. And over 85% thoughts are negatives. So if you can address those, because they are coming from a feeling, an emotion somewhere, or a memory, you address that on daily basis. Imagine the amount of cleansing that you do in your system.
Okay, Rahul has a question. Rahul, please go ahead.
Yeah. Hi. Thank you, Jasprit, for this lovely session.
Hi, Rahul. Welcome.
Hi. So just wanted a thought from you. So it just only reduces the impact at that particular moment, or this particular exercise also helps you in the future kind of a thing. Let's say example, I have some past memory which keeps bothering me on and off. So I do this exercise at that moment when the thought comes in, and probably it reduces its impact at that point of time. But can that, what is the energy which is blocking all the time, can it change in the future course and completely wipe out and things moves in the positive direction?
Yes, Rahul, that is exactly what it is doing, is that, you know, the connection that the eyes have to that part of the brain where memories are stored. There is something that is happening there when you move the eyes in that direction. So I would go ahead and say that don't even wait for that thought or that memory to pop up. Get that memory, recall that memory, and run the pattern. And you would see it in times to come. You may have the memory, but you will not feel anything when you think about it. So that charge that it carries, it may make you feel dull, tired, hopeless, frustrated. You will see that the memory remains, but it just doesn't say anything. Or there is a scenario that the memory may just fade away and you will not be able to recall it.
Oh. Okay. So I don't know if I can ask a follow-up question to this, Nikate bhai. Are there more people?
No, go ahead.
Okay. So I have certain particularly bad, I would say, bad experience with money overall throughout my life since the childhood, and in different phases it is. I could now see a pattern to it, and which I think it is still creating a problem, or you know, kind of, I could now sense it thanks to Nikate bhai, that I've been attending some sessions, that I could understand where is the energy blocking. How should I overcome and have a better experience with the money?
Okay, so one of the ways, if you know, while we talk about IEMT here, is that blockages that you feel in terms of finances or money, how does that make you feel?
So it's always given me a nervousness and a kind of you know, a worrisome kind of a feeling. Anything that I would do, I always it takes me to a negative side of it.
Exactly. So what we are going to do, and we'll connect offline for that, is we take that nervousness and we work with that using IEMT, and then you'll be able to see the results for that.
Sure, I'll be happy to connect offline on this.
Okay, so Rahul, we are going to form a special purpose group again. So please join that group, and Jess will be there in that group.
Sure.
And we'll take it from there.
Sure. Thank you, Nikate bhai. Thank you.
Talk about all these things in that group.
Thanks, Rahul.
Thank you so much. Thank you. Thank you.
Thank you. Yeah. Kranti, please ask your question.
Hello.
Yeah, please go ahead. Please switch on your video so that we can see you.
I have an issue with the video, so I'm
okay. No problem. Go ahead.
Thank you both of you for this wonderful session.
Thanks.
Just I had a question that since you are saying there are certain fixed patterns.
Come closer to your mic, Kranti. We can't hear you.
Yeah. Can you hear me now?
Yeah, better.
So since you said that there are certain patterns associated with, let's say, visual or auditory and all those things, can you make out looking at the person whether he's lying or he's saying the truth, something like that?
Okay, we are going to venture into a different domain, but I'll answer that very quickly.
Okay.
I would recommend don't do that.
Okay.
It just is that human beings react very differently, and the eye patterns could also be very different. We have to test using questions that which ways are the eyes going when you ask what.
Okay.
So once you've tested that, you have the pattern of that individual. Do not copy paste or generalize model on that person. So once you have that, then you can still gauge, but I mean, don't get engaged in such things.
Yeah, understood. Yeah. Thank you so much. Thank you so much.
Kranti, I would say that, you know, this this therapy works very good in clearing yourself. Rather than looking at what the other guy is doing, work on yourself. That's, I think, a better thing to do. Because we are not therapists here, right? We are just wanting to grow ourselves and grow ourselves.
Right, sir. Right, sir.
So why I brought up the eye accessing chart for you, that is for you to see that how the work of NLP and neurology got combined to create IEMT.
Okay.
So it was only to talk about that aspect that I brought that up.
Okay. It's not a fixed pattern. It's not a fixed
pattern. It's not a fixed pattern at all. And please do not believe that. I would like to reiterate that again, that eye chart that I showed you of eyes going in various directions, that was only to tell you how IEMT started with NLP and neurology. It is not to be taken as sacrosanct.
Okay. Very insightful. Very insightful. Thank you so much. Thank you so much, both of you.
Thank you.
Okay. Bidu, please ask your question.
Hi, Jess. How are you?
Hi, very well.
I wanted to know, are there any fixed number of times that you go right to left and diagonally?
Okay, so ideally it's 3 times each side, and that is enough to bring about the change. 3 times each side, so 40 seconds is good enough.
So 3 times each side means left to right, it would be 3 times, and then right to left 3 times.
Yeah.
Okay.
All the 3 directions, 40 seconds, basically.
Okay. Thank you.
Yeah, but I would recommend, just on the basis of what you saw me doing with Nikate, please do not try it, because I don't know what kind of memories would come up for you. So just refrain from doing that. Get in touch with me or reach out to Nikate for that.
Okay, thank you.
Okay. Join the club. Yeah. Leslie?
Yes, hi. Could you just very slowly go over the patterns again and say,
Leslie, start your video, please.
I'm sorry, I can't do it.
Okay.
This time, yes. So just very carefully go over the 3 patterns that you just repeated and say left to right, but slowly.
Which ones are you talking about?
The ones you just talked about, the right to left, left to right, and then diagonally. Can you just kind of use your hand to show?
So. Okay, so that's basically the basic pattern of IEMT. And even if I go through that, I don't know what value will it add to you at this point, because you do not know the right pattern at the moment. Still, I will take you through it.
Right. I just want to know the basic pattern that you use, because I've done NLP and I do EFT and different things. So I basically know NLP. I did it 30 years ago. So so it's something new. So I want to know.
Yeah, but this is different from NLP and EFT. So basically what we are doing here is that we are moving the finger laterally 3 times.
Good. Yeah.
And we are going this way.
Okay, wonderful.
And then we are going this way.
Okay, and you start from the left or you start from the right, or does it matter?
You can start anywhere, it doesn't matter.
Okay, good. So, okay, could you do it just one more time? Thanks.
This is a lateral movement.
Right, great.
This way.
Yep.
And this way.
Perfect. Thank you so much, and thank you so much, Nikate, and for this wonderful lecture and all the other ones. Thank you.
Thank you. And I want to repeat this thing again and again. Nikate, sorry, I think it requires repetition. Please do not do this on your own. You do not know. I was not in favor of doing it. And when Nikate said, can you do a demo, I reluctantly agreed. Please do not try it on, because you do not know what the full pattern is. Do not try this on. They say half knowledge is dangerous. Please do not do this at this point in time.
So what I would suggest is, again, I'm repeating, we'll form a special purpose group. You join the group and we'll have more detailed discussions on that group, or we'll have more Zoom sessions or whatever. We'll work something out. So don't try this on your own, please. Okay. Yeah. Okay. Pradeep. Yeah, Pradeep, please go ahead.
Hello.
Have you, if we can see your face. Yeah. Pradeep here.
I just wanted to know when sometimes we get so disturbed sleep due to might be some negative thoughts or some fear of unknown or fear of future, and you are not comfortable, or and can you do this thing, some practice, and then it can help you?
Yes. So we will start with the fear,
Yeah,
as you said. What is that about? Go to a memory and do this pattern with it. Yes.
Okay.
Yeah.
Thanks.
Okay, thank you.
Annalisa, Annie, she had a question and she said she's not able to raise her hand. So
Who?
after
Yeah,
Annalisa,
so 1 second. Just Lati is there.
Okay.
Yep. Please ask.
Hi, sure. Thank you. Actually, it's not a question that I have, but since a lot of people here do have questions about how it works, and I personally experienced it with just last year. So I just wanted to share a little bit of my experience.
Beautiful.
It had been one of the toughest times where despite having studied psychology and NLP, I'd been going through counselors and trying whatever I possibly could. But the level of fear that I had, and I would probably say that I was going through PTSD, and with 2 sessions that just took with me, I till date, which has been almost a year now, I don't see those patterns repeating, those thoughts or those emotions that I probably was trying to work through. They don't affect me anymore. So for people who have questions about whether it is effective, whether it lasts, then I personally, from my own experience, would like to share that not only for that very moment, but going further for the future, it will have a wonderful impact on you, a positive one, where you will see life-changing things in terms of how your actions, behaviors, thoughts, everything changes.
Beautiful. Thank you for sharing. Thank you for sharing.
Thanks, Adi.
Anyone else has any questions?
Anna, I'm going to unmute you so you can.
Yeah. Can you?
Annalisa, go ahead.
Hi, can you hear me?
Hi, yes, loud and clear.
Just 1 minute.
Yeah.
Okay.
Thank you.
Hi. So I wanted to know, like you mentioned, it's with problematic social behavior with children. So I wanted to know, there will be multiple behaviors and things that you see with children. So how do you pick on what are you going to work with?
So we don't really pick anything. Let the child decide what is he or she feeling at the moment, and we pick up that feeling, get to the memory, run the pattern, and see if it works. Okay. So there's not a picking that we are doing. We are allowing the individual to pick what he or she thinks is impacting the most in his life at the moment, and that's all. Take it on from there.
Okay. Okay. Thank you.
Thanks.
Anyone else? Anyone else has a question? Yes. So this is Sound Pot. That's a funny name.
Oh.
Switch on your video and you can introduce yourself, who you are.
Okay. Sorry.
Don't worry. I'm not sorry. We are happy.
No. उसमें मैं ओम सेठ बोल रहा हूँ.
ओम जी.
हाँ जी. जसप्रीत जी, बहुत अच्छा आपने एक्सप्लेनेशन दिया. बहुत खुशी हुई सुन के. कहते हैं ना कि नानक ने कहा था कि नानक दुखिया सब संसार. जिंदगी में इतने हमारे हादसे हुए हैं, एक एक करके अगर हम उनको याद करें तो क्या कलेक्टिवली सारे हादसे एक ही दफा में रिमूव कर सकते हैं कि वो धीरे धीरे एक एक करके रिमूव करनी पड़ेगी?
जी, आप करके देखिए और बताइए कैसे होता है. मेरा एक्सपीरियंस अपना यही कहता है कि मैं बहुत सफाई अपनी जिंदगी की और लोग अपनी जिंदगी की बहुत सफाई कर पाए IEMT से, पर जब आप करेंगे तभी आप जानेंगे. एंड फॉर
वो तो करना ही पड़ेगा. वो तो करना, आपकी एसोसिएशन से करना ही पड़ेगा. तो मुझे बहुत अच्छा लगा सुन के कि ऐसी टेक्नोलॉजी भी है कि हम तो एक मेडिटेशन करते थे त्राट का. आपको तो मालूम होगा कि मोमबत्ती को जला के उसको कंटिन्यूसली देखते हैं. उसमें भी काफी कंसंट्रेशन मिलती है, लेकिन कोई वो हमारी जो पीड़ा है वो दूर नहीं होती, उसमें खाली कंसंट्रेशन होती है.
तो पीड़ा को दूर करने
आपने
के
तो
लिए अच्छा है।
पीड़ा, अच्छा त्राट का भी अच्छा है क्या?
नहीं IEMT
त्राटका
अच्छा है।
के
त्राटका is just
आज
for
ओके
focus and concentration, no?
या कंसंट्रेशन या
हाँ जी।
तो नहीं, मैं वही डिस्टिंक्शन पूछना चाहता था कि कैसा है। बहुत अच्छा लगा सुन के, बहुत बहुत शुक्रिया आपका।
Thank you
very much. Thank you.
Thank you.
Okay,
So just want
anyone
to
else?
highlight, Nikate, 1 second to say one thing here, that when you are when you're concentrating and focusing before meditation, which is what Trataka is, you're just doing, as it says, focus and concentration. This is a technique that has a neurological basis, and it helps you take care of those memories. And what he said, that, you know, everybody is unhappy, everybody has a lot of memories. Omji, when you will get to doing this process, you will realize that if it is not a severe abuse or a trauma that you've been through, that people have been through, all we have in consolidation is just those 20-25 major memories that cause a lot of trouble for us. If we address those, we are mostly sorted. And with those 5 patterns of chronicity, believe you me, 80% of life just sorts itself out.
Thank you very much. बहुत बहुत खुशी हुई।
Thank you. Thank you, Omji. Okay, does anyone else have any questions? Anyone else? Okay, I guess we are done, Jess. Thank you so much for the session. I know I goaded you into giving a demo, but I think that made the discussion more alive and stimulated the entire thing. So,
yeah, but do not do it at home, please.
Yeah.
You do not know the pattern. Please do not try that at home.
Thank you.
Okay, there's some. Okay, people are saying thank you. Okay, thank you so much, Jess, and we'll see you again.
Thank you.
Thank you, Jess.
Thank you.
Good night.
Bye, everybody.
Good
night.
Nikki.
Okay, Ram Ram. Good night, everyone.
Good night. Good
We all
night, Jess.
tomorrow.